السلام عليكم ورحمة الله وبركاته. Um, so you should reply to me right now, guys.
وعليكم السلام ورحمة الله تعالى وبركاته.
Okay, so I hope my voice is clear for all of you.
It's
Can you
clear.
see the Zoom background right now?
It is clear.
Okay, very good. So today, inshallah, we are going to discuss one of the recently appeared exam cases of communication, inshallah. It has appeared in Bahrain Center. It was a straightforward case. However, most of the feedbacks from candidates, they mentioned that it was a shocking case, although it's not supposed to be a shocking case. Anyhow, we are going to discuss this case in details right now. And our guest today is Dr. Sabreen. Dr. Sabreen, are you around?
Yes, السلام عليكم موجودة.
How are you, Dr. Sabreen? How is everything?
I'm good, thank you.
Alhamdulillah Rabbil Alameen. So, ready for this case?
Yes, inshallah.
Okay, so this is the case in front of you. Could you please read it loudly for us?
Okay, you are the SHO in the outpatient rheumatology clinic. Mrs. Joanne Smith.
One. Okay.
Yeah, Joanne Smith is a 30-year-old lady who has symptoms of fatigue and joint pains for more than 5 months. Joint pain is mainly at the back with mild stiffness. However, she also reported widespread joint pains. Fatigue is draining all her energy, and she's feeling too tired to do anything at all. In the last visit, she reported oral ulcers. Mrs. Joanne is an engineer, and she is recently married. Unfortunately, her relationship with her husband is getting worse because of her mood issues. She has got a sleep disturbance which affected her job, for which she has got several warning letters. She visited the rheumatology clinic several times, and detailed history taking and physical examinations were performed by the consultant. Several investigations were carried out, including full blood count, ESR, a thyroid function test, anti-nuclear antibody, rheumatoid factor, anti-CCB, anti-Smith antibody, and LFTs. All laboratory results came back as normal. The consultant believes that she does have fibromyalgia and asks you to sit with the patient. Mrs. Joanne has come now to review her laboratory result. Task: sit with Mrs. Joanne and address her concerns.
Her concern, yes, sorry for her. His should be her. Okay, Dr. Sabreen, I will give you 3 minutes to prepare yourself, and then we will start with Mrs. Joanne. Okay?
Okay. Yeah.
Thank you. Okay, Dr. Sabreen, are you ready?
Yes, I am.
Okay, let me adjust the time for you. So, this is Mrs. Joanne in front of you. You have 10 minutes with her, so your time starts now.
Okay. Hello.
Hello?
Hi, am I speaking to Mrs. Joanne?
Yes, I'm Joanne.
Hi, my name is Dr. Muhammad, one of the junior doctor on the joint clinic today.
Hello, Dr. Muhammad.
If you can confirm your age for me, please.
Yes, I'm 30, doctor.
Great. We are here today to discuss some issues related to your health status, and and at the same time to address any concern that you have. Will that be okay?
Yes, doctor. Thank you very much.
Great. If we can start by asking you, how are you feeling today?
Oh, doctor, I'm still suffering from this joint pain, from this tiredness. It's
Mhm.
really terrible, doctor. It's really affecting my life.
Yeah. Yeah, I know it's very stressing as well. Sorry for your suffering and you are going through all this. Just to make sure that we are on the same page, if you can tell me how far do you know about your health condition?
Yes, doctor, as I have told you, I have this joint pain, multiple joint pains, doctor. Okay, and
Mm-hmm.
this tiredness. It's really going on through, I think 4 or 6 months ago. And actually, I have been suffering also from this swinging of moods. Sometimes I'll be okay, sometimes I'll be so depressed. It's really
Mm,
affecting my social life. It's really affecting my job, And last week, I came and I was examined by one of the senior doctors. Okay, he requested several investigations. But doctor, last time, I have this soreness in my mouth. It just recently appeared. So I
okay,
just want to know what could it be, and I just want to know what are the result of my test. I
okay,
want to know what's going on. Really?
right. Uh, yeah, I'm so sorry to hear that you are going through all this situation. I get the result of your blood test and all the tests that you have been underwent.
Okay, good.
And yeah, and just to reassure you that all the results came back as normal.
What?
Yeah, the result didn't show any underlying disease.
Doctor, do you think I'm maling I'm putting on symptoms? Do you think I'm lying?
Not at all, Mrs.
Do you think
Juan.
I'm malingering? Um, I told you I'm suffering, and now you are telling me
Yeah,
that the result showed that no disease. I'm tired.
yeah, I understand your frustration and that you get shocked by the result. But although the result is not showing that there is a specific condition, after reviewing with the consultant, he is decided that you have a condition that is called fibromyalgia. We are not thinking that you are making up all these symptoms. I admit that you have these pains and all the trouble that you are going through. Do you know about the fibromyalgia?
Fibromyalgia. What is this? What is this, doctor?
Yeah, yeah. I can explain for you more if you want.
Yes, please.
Okay. Fibromyalgia is a medical term for a medical condition on which the patient have multiple pains and aches in different parts of the body. And on the same time, they have other uh, problems and presentation like problem in their mood and their sleeping. And this, if we put all this together, will give the picture that you have. Am I clear so far?
Um, yeah, you are clear, doctor. But what could be the reason behind this?
It's one of the disease that we call them a functional disorder.
What do you mean by
Uh,
functional disorder?
yeah, yeah. Functional disorder is when the brain interpretation to the signal is different, is abnormal interpretation. So the brain is taking the signals and interpret them as pains and aches and give us all these symptoms. That's why we call them as functional neurological disorders. Neurological means it came from the nerves and the brain. Does that make
Okay.
sense?
So, is it a final diagnosis, you mean?
As we haven't got any evidence for other joints problem or specific problems, this all going with the fibromyalgia.
Okay, and how about this oral soreness, doctor?
Yeah, I haven't assessed them myself, but if you get them again, we can have a
I
look.
have it right now. I have it right now.
Okay, it's also considered as part of the fibromyalgia. The oral ulcers is not specific for having any specific disease. It can be part of any other different conditions.
But you have mentioned that I don't have anything. All lab results has been resulted as normal. Is that right?
Yeah,
So
all the results are normal, but the oral ulcers
what
can
do you
be
mean by
also
oral
part.
ulcer?
You have this sores in your mouth. We call them
Okay.
ulcers.
Mm-hmm.
Yeah. Sorry for sometimes using medical terms. If you get confused by any, please just let me know to clarify more.
No worries.
Okay. So the sores in your mouth is also can be part of different conditions, and one of them is the fibromyalgia as well.
Okay, so what to do, doctor? To give me any kind of treatment. I'm really suffering, doctor. My social life is gone. My job is about to. I'm about to be fired from my job. Just give me any treatment.
I highly appreciate your worries, Mrs. Joanne. Just to reassure you, we will be beside you. We'll give you the best plan of management until you feel better and you can cope with all this. The plan of management will be you will be managed by a multidisciplinary team. So different members from different team will be included. It will give you appropriate painkillers will suit you and will give you a good time for rest and sleeping as well.
Okay,
And on the same time, we can ask the physiotherapist to be involved, so they can give you some type of relaxing exercise and so to relax your joints and muscles.
okay,
Okay. You are working as engineer, as I get from your note. So if you need any time off, we can give you a fit note, or even we can refer you to the occupational health team so that they can give you some consideration. Will that be okay?
2 minutes left. Okay, doctor. Okay, so for how long shall I receive this treatment, doctor?
Yeah. Also, one of the member of the team that we need to involve is the mood doctor. Uh,
Doctor,
yeah,
why
the
doctor?
mood the mood doctor can help you to cope with the stresses and give you some techniques to overcome all this.
Okay.
And if you're happy, we can make the referral.
Um, I'm not sure, doctor. Mood doctor, I'm not mad to be referred to a mood doctor.
Yeah, I understand that. The mood doctor for the is not for the mad people. The mood doctor actually have different techniques to cope with the anxiety, stress, and different problem that all of us can go through.
Okay, no worries, doctor. But for how long shall I take this treatment? I mean, for how
Yeah,
long? I mean, what is the time of getting cured?
yeah. There is no time frame that we can say, or cut off time that we can say all these symptoms can end with. We will work all together through this. It can make weeks, months, or even longer, but be sure we will be with
Oh,
you through all this until you can overcome all these problems.
okay, fine, doctor. No worries.
Okay. Do you have any specific concern apart from this?
Nothing so far right now.
Okay. I will ask you a few questions. Are you smoking?
No, I don't smoke, doctor.
And what about your
But
alcohol
continue, Dr.
intake?
Sabrin. Continue. Okay.
Okay. And what about your alcohol intake?
Yes, sometimes, especially that nowadays I'm feeling so depressed. Sometimes I take alcohol, I drink alcohol, but I'm aware about the recommended units. I'm not exceeding them.
Okay, that's great. Yeah, it's better to be just restricted to the uh the limited units, because if you go above them, then you will be on other problems.
Okay. Okay.
And Yeah, I understand that all these symptoms impacted your life badly, isn't it?
Yeah, doctor. I'm recently married. My husband actually, he was supportive, initially. However, in the last couple of weeks, I think he is thinking that I'm putting on symptoms. So, sometimes
Yeah.
he getting annoyed, and I cannot find any support from him so far.
Right. If you want, you can bring him with you on the next appointment so we can explain to him more. That it's up to you if you want that to happen.
That would be great, doctor. Yes, that would be great.
Yeah. And regarding your sleep, we can give you a brochure about the sleeping hygiene and some techniques that you can use along with the painkillers to improve your sleeping.
That would be good, doctor, also.
Right. So at the end, I will give you some leaflets about the fibromyalgia and to have a look about this condition in more details. And I will make all the referrals that you need, and you will be on regular follow-up with us until you become more stable. Thank
Okay,
you so
doctor.
much.
Thank you very much, doctor. Thank you. Okay, Dr. Sabrin, mashallah. Uh, have you heard about this case before, or have you practiced this case before of fibromyalgia?
No.
Okay, this is a good start. Okay, before I proceed and start addressing the addressing the case, I just need to take a feedback from all of you guys about this case and the performance of Dr. Sabrin before I start mentioning my comments.
Doctor, plan of treatment should be more clear that you will be treated by a team including occupational therapist, physiotherapist, specialized nurse, social worker, mood doctor, joint doctor like this. I think so. Rest she done perfect and excellent.
She has mentioned this. She has mentioned the mood doctor. She has mentioned the physiotherapist. She has mentioned also the several things in the plan of management. She has mentioned that. But what do you mean? What do you mean it should be more clear? She has mentioned all of these.
I mean, doctor, like in the plan of management, we can say it in one go, like you will be treated under a team and team include
Mm-hmm.
this, or like in one go, we can tell this thing that you will be treated under a team and we should name all the team members.
Mm-hmm.
This
By
is
the
my
way,
clue.
the good thing in communication, Dr. Rizwan, it appears for me here, Dr. Rizwan. Okay, thanks for
Yeah,
your
yeah, sure.
comments,
Thank
Dr.
you.
Rizwan. The good thing in communication, by the way, there is no fixed rule about anything. You are right, and what is done by Dr. Sabrin is right. Everything has got its disadvantage. For example, in the case of Dr. Sabrin, she mentioned them separately, so she will be vulnerable for forgetfulness of some points, which is not going to be your case if you mention all of them in one sentence. Okay, so she has done the right thing, and you have mentioned the right thing also. However, I prefer personally, what you have mentioned, what it is mentioned by you, Dr. Rizwan. Mention all of them initially, and then you can start dividing or mentioning or explore every single point you have mentioned already. I prefer this, but what is done by Dr. Sabrin is not I'm not going to say it is wrong. However, everyone has got his own or her own approach. Is that right?
Okay, agreed, doctor. 100%
Yes.
agreed.
Okay. Thank you very much, Dr. Rizwan. Any other questions, guys?
Thank you.
Okay.
Hello, Dr. Muhammad.
Yes.
Sorry, I attend late. Did she ask about any stress in condition in her life?
No. Thank you very much.
Yeah,
It's one of the most important points that you need
yes.
to mention, and you need to ask about them. Thank you very much, Dr. Sousan.
Okay.
Hello, Dr.
You are
Muhammad.
welcome.
Hello.
Uh, we need to ask about alarm sign and symptoms of
Sign and
like
symptoms of
any
what?
alarm sign, any loss of appetite, any weight loss, any blood coming through back
Okay.
passage.
Let me ask you, why do you want to ask about alarming signs?
To exclude his worry. If he worry
worry about what? You mean the oral ulcers?
yes, if there is about cancer or something.
Okay, not about cancer. However, she is a female. She's having joint pain, okay, from time to time, and she's having some sort of stiffness. However, aphthous oral ulcer is usually associated with couple of things. One of them is it could be something normal. It could be part of fibromyalgia. It could be part of other diseases. I mean, rheumatological diseases like, for example, SLE. Okay, it could be part of other rheumatological disorders like Behçet's syndrome, for example. So it is very important also to give a safety netting at the end of your conversation with this patient. I'm going to do it for you, inshallah. Not to ask, but however, you need to give it as an advice. If you develop this, if you develop this, if you develop this, you need to come back.
Okay.
Thank you very much. Any other questions? Okay, now it's my turn now.
We can fix it? How
Yes.
we can explain from her this
I'm wondering.
fibromyalgia?
Yes, I'm going to mention this, inshallah. No worries. Any other questions, guys?
Yeah, just I'm wondering when the patient saying that I have this, what is the cause of this mouse ulcer? Just
We will see, inshallah.
I just listen and continue
Yes.
asking. Okay, thank you.
We will see, inshallah. Okay. Okay. Thank you very
I
much.
have one
Dami.
question. I
Yes,
have one
doctor.
question.
Last question. Yes.
If we explain that the all the labs are in normal and the patient or the candidate still say that I have joint pains, you have to check again my labs or do again this investigation. How we tackle this question?
We will see now, inshallah. No worries. Okay. Okay. Dr. Sabrin, mashallah, you have done a great job. This is an excellent performance, especially you did not practice such a case before. This case, actually, as I have told you, I did some modifications in it. However, the concept is going to be the same. It came in Bahrain Center just, I think, last week. So your performance, Dr. Sabrin, I have several comments here. As I have told you before, whenever you are practicing any communication case, you need to put them into several portions. The first portion is an introduction, an impressive introduction. And then you need to have a container. A container, I mean, it is going to be your task. It is going to be your task. As you can see here, introduction, impressive introduction. And then container, complete container. And then end. And the final thing that you need to conclude with this patient. If you divide your task into 3 portions, you are going to be safe. Regarding the introduction and end, they're supposed to be fixed. However, the variation is going to be in the container. Now, regarding your performance, Dr. Sabrin, you have done an excellent and impressive introduction. Thank you very much regarding this point. Okay. And you have followed your introduction with a very nice sentence. I will put it under the skill of patient's welfare. You have asked the patient, how are you so far? After you have read the whole complaint of the patient, I mean, after you have read the whole scenario, how are you doing so far? This question is going to be pointed and marked under the skill of patient's welfare. You are really taking care about your patient. Okay, you are not just like a robot. You just want to finish your task. No. And never ever, I always keep saying to my colleagues, never ever make your communication case as a tick box approach. Never ever keep it like a tick box approach. It's supposed to be one-to-one approach. One-to-one approach. And the second thing, the second golden advice, I always give it to my colleagues. All of us can be good physicians. However, not all of us are good communicators, unfortunately. And who is the good communicator? The good communicator is the good listener. The good communicator is the good listener. The good doctor, he is the doctor who is going to give the impression of guiding the conversation to the patient, not to the doctor. So you have done a very nice and impressive introduction, Dr. Sabrine. This is very good. Patients welfare about asking, how are you doing so far? This is also very good. Okay. And then regarding your container, regarding your task, you have mentioned that this patient has got several investigations. However, to be more impressive, before relying any results, just ask the patient, have you got any expectations? Do you have any expectations? Have you been told about the result? Okay. And then you need to mention the result of the patient. The next point is, I was so happy when you mentioned the word neurological, and then you immediately translated. You have discovered yourself that you have mentioned a jargon. You have translated immediately and corrected by coming from the nerves. This is one of the things, guys, I want all of you to keep it as a habit inside your mind. All of us can make mistakes. All of us can mention jargons unintentionally. However, if you feel yourself, or if you have mentioned any jargon term, immediately translate it into a lay person term, like what has been done by Dr. Sabrine. However, I was so nervous and I'm about to catch your neck, Dr. Sabrine, when you mentioned oral ulcers. You have mentioned it once, okay, I ignored it, but when you mention it the next time, I purposely told you what is oral ulcer. So please be careful. Be careful from mentioning jargons. And if it is the case here, immediately translate it. Okay. The second thing is regarding paracetamol, and I mean the simple painkillers, they have no role in managing of fibromyalgia. I mean paracetamol and non-steroidal anti-inflammatory drugs. They have no role. Simple anti-analgesia. You mentioned simple analgesia, simple painkillers. You meant by them paracetamol and non-steroidal anti-inflammatory drugs, Dr. Sabrine?
No, I mean that we will use different type of painkillers which will
What are
suit
they?
her.
What are they?
I mean the amitriptyline, the
Okay, very good.
gabapentin.
Very good. Yes, very good. So you need to mention, yes, special type of medications, because paracetamol actually and non-steroidal anti-inflammatory drugs, they don't have any role in managing of patients with fibromyalgia. The last thing you have mentioned is something really very impressive, and it should be part of the management in this case, particularly. They have mentioned to you in the scenario that she is struggling from social point of view with her relationship with her husband, and she is about to get fired because of this. She has got several warning letters. You have touched the issue of partner counseling perfectly. However, you did not touch the issue of her job. You need to mention it, especially it is mentioned for you very clearly in the scenario. She has got several warning letters. So how are you going to touch it if I give you a chance right now? How are you going to solve it?
Okay, I will mention to her regarding your work. We can you can contact your work if they can make for you a FaceTime for return to
Okay,
work, or if you need time off work, we can give you the fit note.
very good, very good, very good. So there are several things you could have done for this patient regarding her job, because she is about to get fired because she got several warning letters. So this is one of the hidden things that you need to write them very carefully outside before you go inside and start addressing the case with Mrs. Juan. You need to write them to include them in your management plan. But I was really impressive when you mentioned that you need to how about bringing your husband here for partner counseling? This is something very impressive, actually. And the second impressive issue also is the steps or the management of the sleep hygiene. I'm going to mention it also for you. The only thing that I was expecting to hear it from you, Dr. Sabrine, is have you got any kind of stress in your life? Because as you see, and all of you know, that functional disorders, or they are sometimes called medical explained symptoms, medically unexplained symptoms, you might find it like this: functional disorders or functional illnesses or medically unexplained symptoms. Stress actually in different aspects of life, either at work, stress with the family, financial problems. Stress actually plays a major role in inducing of such problems. So I was expecting to hear and to take some historical info about any kind of stress, to include it and to formulate it in your management plan. Other than this, you have done a very great job, Dr. Sabri. Thank you very much. Any question, Dr. Sabrine?
Just thank you so much for giving this chance. I'm really very grateful.
Thank you. You're welcome. Okay, guys, now let us see how are we going to master this case perfectly, 100%, if it comes. And the purpose of, or the rationale behind bringing this case, because if you remember in the last diet 1, the most common scenario was medical error scenarios. It was keeping repeatedly in several diets, in several centers, in several days. So I think I have a belief they might repeat this scenario in any center in this diet. So it is better to know it 100%. Now, let us start with introduction. Hi there, my name is Dr. Muhammad, as mentioned by Dr. Sabrine. Remember to mention your family name, not the first name, your family name. My name is Dr. Muhammad. I'm one of the doctors covering the service today. I'm one of the doctors covering the joint clinic today. Am I speaking to Mrs. Juan Smith? And better to identify the patient with complete name as mentioned to you in the scenario. No need to identify the patient by the age, by the way. Are you Mrs. Joanna, 39 years old? No, keep it simple. Am I speaking to Joanna Smith? Full stop. That's all. Yes, I'm Joanna. Or can you please mention your name with any phrase you want? The endpoint is to identify the patient's identity with the complete name given to you in the scenario. Am I speaking to Joanna Smith? Yes, nice to meet you. Nice to meet you too, doctor. Mrs. Juan, we are here today to discuss about what's happening with you recently. Would that be okay with you? You're taking a permission from the patient. Yes, doctor. Would you like to invite anyone to attend this meeting with us? This sentence keep as a stamp in all communications cases, except in some scenario in some cases. Could you please mute? Never ever offer this invitation, for example, to patients with HIV or patients with suicidal attempt because of patient's confidentiality. Now, I will be asking the same question done by or asked by Dr. Sabrin. I can see that from your case note that you have been suffering from tiredness, joint pain, and recently you have started suffering from mouth sores. Is that right? Yes, doctor. How are you doing so far? Is everything okay with you? And then the patient is going to express some complaint. I'm still suffering, okay? I'm still having this joint pain, etc., etc. You need to listen. Don't forget, good communicator is the good listener. Okay? Now, okay, let me just... Guys, could you please mute? Okay. Now, I can see that now we have started going to the container. The container. I can see that from your case note that you have been suffering from 1, 2, 3, 4, 5. What is mentioned in the scenario, is that okay? Is that right? How are you doing so far? And then you need to move and mention about the investigations. This is the container. You have visited the joint clinic several weeks ago and you have been examined by our consultant who requested several investigations for you. Is that right? Yes, doctor. You can see now, guys, I'm mentioning some things already written in the scenario. However, I am transferring all of these sentences to be in one-to-one dialogue. One-to-one dialogue. Is that right? Yes, I want the patient to speak. I want the patient to guide the conversation later on. Now, you need to tell the patient about the truth. Telling the patient about the truth about normal results here in this point in functional disorders or in medically unexplained symptoms, believe me, you are going to take the whole time is going to be spent in this part. I'm going to show you why right now. Because you are going to hit the patient with several shocking news by telling her everything is normal. She is suffering in front of you. She's going to be upset. She's going to be more anxious. She's going to be angry. And she might hit you with several concerns, like what I did exactly. Do you think I'm malingering? Do you think I'm putting on symptoms? Do you think I'm lying? Okay? Immediately in this point, you need to hold and you need to let the patient express the entire feeling. All what I want from you is just to get relaxed and listen to the patient. You need to use your weapons to calm down the patient after she expresses her anger. Using several sentences. For example, I can understand your situation. This is not the thing that you were expecting to hear. I know that. We believe that you are really complaining and looking for a help. I didn't say that you are lying. I didn't say that you are putting on symptoms. Normal result doesn't mean that you are not having any problem. I understand this very well. So you can see there are several phrases. You can use them in order to calm down the anger coming from the patient. And before that, you need to tell her that everything is normal. But before that, do you have any expectations? Keep it like as a stamp. Any expectations? No, doctor. Now, all results have been shown that you don't have anything. Not you don't have anything, but all results came back as normal. I can understand the situation. There is nothing. This This doesn't mean that you don't have anything. You have got a diagnosis called fibromyalgia. Have you ever heard about it before? And then you need to explain fibromyalgia. So my advice for all of you guys, whenever you are explaining any disease to the patient, keep it very simple. Keep it very simple in a lay person terms. Keep it very simple. So fibromyalgia, or sometimes it is called fibromyalgia syndrome, is a long-term condition that causes several symptoms, including joint pain, tiredness, sleep disturbance, difficulty in concentration, forgetfulness, mood problems, etc., etc. So you just need to mention the major symptoms: joint pain, mood problem, sleep disturbance, mood changes, difficulty in concentration, okay, tiredness, etc., etc. What else? These symptoms are changeable. They are changeable. They can sometimes suddenly improve, and they can sometimes getting worse. This disease has no specific test. Regarding the sore in your mouth, can I ask you a question, Mrs. Juwan? Yes, doctor. Have you got any dry mouth? Have you got any dry mouth? The answer, usual answer, it should be yes, doctor. Patients with fibromyalgia are vulnerable for dry mouth, either by the disease itself or as a side effect of one of the medications, which is amitriptyline. So, have you got any dry mouth? Yes, doctor. Okay. Because several patients with fibromyalgia will be vulnerable for dry mouth, and any patient with dry mouth, eventually, this can lead to mouth soreness. This is going to be the explanation of mouth sores in this patient. And as you can see here, I have looked into literature. You can see here oral symptoms associated with fibromyalgia syndrome. You can see here below these two pictures, studies have described oral problems associated with fibromyalgia syndrome, including sicca symptoms, oral ulcerations, and orofacial pain. So, patients with fibromyalgia will be vulnerable for dry mouth, and every patient with dry mouth will be vulnerable for oral ulcer, or it could be part of the disease. This is what you should describe these symptoms to the patient, because she is really very worried about this oral ulcer. Now, the exact cause of we are still describing fibromyalgia to the patient. The exact cause is unknown. However, sometimes it might be related to an abnormal link with your body and the brain. Abnormal link with your body and the brain. Genetics sometimes can play a role in this condition. It can run in families, sometimes, not always. It can be triggered by some conditions like infections and stress. And at this point, I would like to ask you a few questions, Mrs. Juwan. Have you got any kind of stressful condition in your life? This is very important because, as I have told all of you guys, stress plays a major role in dealing with functional disorders, functional illnesses, or medically unexplained symptoms. Have you got any kind of stress in your life? For example, social life, any friendship problem, any partnership problem? Are you struggling financially? Are you struggling with blah, 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 etc.? You need to tell the patient that stress has been shown to be associated with fibromyalgia. If it is not addressed very well, the patient will be vulnerable for flaring up of symptoms of fibromyalgia. There is no cure for this disease. It is going to be a lifelong problem. And when you mention this to the patient, she might be very upset because there is no cure. You need to follow this sentence by one of the very nice and impressive sentences. I like them very much. It can be very frustrating to live with and can have a big impact upon your daily life. However, you are not going to be left alone. There are some major measures we can do in order to help you overcome your symptoms. I will repeat this sentence again. There is no cure. It is going to be a lifelong condition. I know that it can be very frustrating and it can be having a very big impact upon your life. But don't worry, we are going to give you the whole support with several measures to overcome your illness. And then you need to go and start addressing the treatment plan. There are 6 steps or 6 points in every functional disorders, either fibromyalgia, conversion disorder, and conversion disorder, one of the scenarios that also came last week. The patient has got symptoms and her CT, brain CT is normal. So most likely she is having a conversion disorder. So whatever the functional disorder is, the treatment plan is going to be consistent of or going to be composed of 6 major points. 6 major points. If you fulfill all of these 6 points in every functional disorder, you will get 100% in your performance. Either IBS, conversion disorder, fibromyalgia, chronic fatigue syndrome, etc., etc. What are these points? Number 1, I will write them here in the chat box, and then I will start mentioning them. Number 1, proper counseling. Number 2, lifestyle modification. Where is it? Modification. Number 3, conviction. I will explain everything, don't worry. Number 4, medicines, if needed. Number 5, psychological input, if needed. And lastly, support groups. So let us take them one by one. This is going to be the treatment plan of all functional disorders. It's a multidisciplinary team approach. 6 steps need to be fulfilled properly. Number 1, proper counseling. So proper counseling, by understanding the problem and the impact on patient's life. And remember, The good physician is a good listener. You need to provide the patient with several issues according to what is mentioned to you in the scenario. First of all, you need to tell her and you need to give her the concept that normal results doesn't mean that you are not suffering. You are having a disease. And you need to explain this disease in details. Proper counseling. You need to understand the problem. You as a doctor, and you need to reflect it to the patient properly. At the same time, to solve any issues related to that disease in regard to her social life. For example, this patient is having a very bad relationship recently with her husband. She is having a very bad relationship with her boss in the job. So you need to provide sick notes for her, and you need to advise her by taking to speak to, you can write a letter, and this letter can be taken to the occupational department in her institute to assign her, for example, in non-consuming energy jobs, for example, or she can take some days off. There are several things you need to mention them in this regard. The second thing, how about offering couple counseling as mentioned by Dr. Sabrin? The purpose of the couples counseling is to help partners learn more about each other. Especially that she told you her husband was initially supportive. However, now he believes that she is lying. He believes that she is putting on symptoms. So the problem is not with her. The problem is with her husband. Bring your husband. We can explain him. We can give both of you sessions of couple counseling. How does that sound with you? This is what do we mean by proper counseling. This is the first point. The second point is lifestyle changes or modifications. There are several things under the umbrella of lifestyle modification in this patient in fibromyalgia. Number one, supervised exercise program. So you need to tell the patient that I'm going to refer you to a special physiotherapist who is going to give you a special exercise program which is going to suit your condition. A special physiotherapist who is going to put or who is going to have a good structure exercise program which is going to suit your condition. This is the first thing. So supervised exercise program. Number two, how about relaxation techniques, Mrs. Juwan? Taking performing deep breathing, for example, meditations, yoga, okay, etc., etc. Relaxation techniques. Number three, how about spending time in performing your lovely hobbies, for example, or lovely habits? How about perform or spending your time in learning new skills? How about spending too much time with families, with friends, with colleagues, etc., etc., trying to distract the mind of the patient from the illness? Number four, perform a good sleep hygiene. Good sleep hygiene, and actually sleep hygiene per se is a very long topic. However, I'm going here just to mention just few points about performance of good sleep hygiene. Number one, I need you to make sure that you need to avoid caffeine and alcohol before you go to bed. I need you to avoid eating heavy meals at night. I need you to make sure your bedroom is comfortable and dark. I need you to get up at the same time every morning. So there are several points in sleep hygiene. You don't need to mention all of them, or you can mention also a topic of the sleep hygiene. And in order not to waste time, you tell the patient that it is very important to perform a sleep hygiene. And I'm going to give you a brochure talking about this. How does that sound with you? It's okay, doctor. Thank you very much. All of these are considered lifestyle modification. So, sleep hygiene, relaxation techniques, yoga, meditation, spending time with colleagues, with family, and supervised exercise program by physiotherapist. This is the second point, lifestyle modification. Number 3, conviction. What do I mean by conviction? You need to tell the patient that because this patient, if she is not convinced by what you have mentioned, she is going to go out looking for another doctor. And the same cycle is going to be repeated. So you need to tell the patient in a very polite way to stop looking for reassurance and information about the symptoms, because repeatedly looking for this issue is unhelpful and it might even worsen your illness. And believe me, guys, you are not going to reach to this point of conviction unless you have done the first point, which is the proper counseling, perfectly. So conviction. Stop looking for reassurance. This is going to be unhelpful. This is going to worsen your symptoms. Number 4, medicines. Not all patients with functional disorders can take medicines. However, for example, in this case, you can provide medicines like antidepressants, low-dose amitriptyline. And as I have mentioned to you, paracetamol and non-steroidal anti-inflammatory drugs don't have any role in management of joint pains in patients with fibromyalgia. Joint pains is going to be relieved by antidepressants, for example, amitriptyline, duloxetine, etc., in very low doses. Okay, is there any other thing under the umbrella of medical therapy? Yes, acupuncture, by the way, can sometimes help reduce the pain and improve the quality of life in patients with fibromyalgia, which is not the case in patients with IBS. Acupuncture doesn't play a role in management of symptoms of IBS. However, recent studies showed that acupuncture can reduce pain and improve the quality of life in some patients of fibromyalgia. Number 5, psychological input. For example, referring the patient to the mood doctor, the psychologist, in order to express the feelings. Sometimes if you only just talk, just talking without taking any advice on how to overcome my symptoms, just talking, this might be having a very positive impact upon relieving the pressure inside your mind. So you can refer the patient to talking therapists, talking therapies, talking groups, or to refer the patient to the psychologist for cognitive behavioral therapy. And lastly, support groups. as I have told you, you can find a lot of people with the same issue. You might share your experience. You might get other people experience, and this is going to be having a good impact upon your condition. How does that sound with you, Mrs. Joanne? So all of these 6 points, I always mention that they are not 6 points, they are 6 pillars in management of any functional disorder: proper counseling, lifestyle modification, conviction, medicines, psychological impact, and support groups. Once you have done all of these, and don't forget, guys, don't forget, don't be like a robot. Once you have mentioned every 3 to 4 sentences, you need to pause to check the patient's understanding. Am I making myself clear? Am I going too fast? Is that clear? Do you need me to express any issues? Do you need me to repeat any points? Etc., etc. Checking the patient's understanding is a sign of a good communicator. But if you have been dealing with this patient like a robot, I need to mention all of these. By the way, no need to mention all of these. If you spend too much time in counseling the patient properly, addressing the patient's concerns properly, and if you did not finish your task, you might get 16 out of 16. There is no worry at all. So don't be like, as I have told you before, communication is not like a tick box approach. I need to finish this, I need to finish this, I need to finish it, not like tick box. No, keep it as a conversation, 1 to 2, 1 to 1, 1 to 1, 1 to 1. And keep the patient leading the conversation. Give the patient the impression that you are the one who is leading, although you are the one who is going to speak too much. However, this is a talent. Am I making myself clear? Do you need me to repeat this again? Is it, do you understand me, etc., etc.? Once you have done all of these points, guys, and then you need to come to the end. And at the end, what are we doing? We are checking the patient's understanding. We are checking the patient's concerns, if she does have any concerns, and you need to mention and address them, and some sort of recapping. And then you need to provide some leaflets, some websites, some brochures talking about fibromyalgia. And I usually prefer to give the patient this website. It's called NHS website. NHS website. Full stop. That's all. Is it difficult?
Thank you, Dr. Muhammad.
Any questions, guys?
Assalamu alaikum.
Alaikum assalam.
Doctor, is medically unexplained symptoms the same as functional disorders?
They are the same, yes. Different terms for one thing.
Okay, thank you.
You're welcome. Any questions, guys?
If the patient is refusing to be sent to mood doctor and asking, I am not mad like this, what I will explain?
You need to tell her anything. For example, referring you to the mood doctor doesn't mean that you have a psychological problem. Mood doctor can give you several modalities or several measures of treatment that can help you overcome your symptoms, like referring you to talking therapies groups, giving you cognitive behavioral therapy. Is that clear?
Yes. Okay.
Any other
Doctor,
questions,
can you
guys?
sorry, doctor, can you please repeat how we can explain functional disorder, like in layman language?
Functional disorder, in a layperson term, you can just mention them that there will be an abnormal link with your body and the brain here in the case of fibromyalgia. It is going to be the same in the case of chronic fatigue syndrome. In the case of IBS, for example, it can be, you can mention it also. It is an abnormal link between your body and your brain. At the same time, it might be having some sort of over-exaggeration of nerves supplying your bowel. At the end, there should be an abnormal link between your brain and your body. And don't forget that stress per se plays a major role in these kind of disorders.
Okay, thank you so
Is that
much.
clear, Dr. Rizwan?
Yes, doctor, clear. Thank you so much.
You are welcome. So fibromyalgia, guys, don't forget fibromyalgia, 6 pillars, not only in fibromyalgia, in all functional disorders, 6 pillars, proper counseling, number 1. Number 2, lifestyle modification. Number 3, medication if needed. Number 4, psychological input if needed. Number 5 is support groups. And the most important point is conviction. Conviction. If you apply all of these 6 pillars in every functional disorder scenario, inshallah, you will pass. I hope that I could have simplified it for you.
Again, doctor, please, conviction. What is meant by conviction?
What is meant again?
Conviction.
Conviction, you need to convince the patient not to look for help anymore. If you are going to look for help or reassurance, again, if you go outside from here, this is going to worsen your symptoms. I mean, you need to accept your diagnosis. Because if you did not do a proper counseling, she might go outside looking for help with other doctors. This attitude per se will worsen her symptoms. Okay?
So you need to tell the patient, don't ask for any more help.
You are not going to tell her, you are not going to tell her like this, because the patient, one of the rights of the patient to have a second opinion. Don't forget this. But you need to tell her, roaming around for reassurance, for example, like this, roaming around for reassurance, trying to get a help, okay? This might be having a negative impact upon your symptoms, and we are here to deal. We have reached to a diagnosis. You have got a diagnosis. So we need to concentrate upon measures to overcome your symptoms. I would like to help you. How does that sound with you? You can see? Yes. This is better than don't go outside to look for help. Why? I need to look for help. Okay?
Of course. It's the right to the patient.
Yes.
To seek help from him.
Okay.
Okay.
Any questions, guys? Okay, I have put my contact number as usual here in the chat box. Okay, and the link for my PACES club group. Okay, in addition to my YouTube channel, you can share it with your colleagues. Okay, and you can contact me.
Can you please say the step again?
Yes, doctor, please.
Can you please mention the step? Mention the step, the pillars in functional disorder. Can you mention the pillars again?
The steps?
Yes, the pillars in
Proper
functional
counseling.
disorder.
Proper counseling, number 1. Lifestyle modification, number 2. Okay. Conviction, number 3. Medication if needed. Psychological support, and support group. One of your colleagues wrote them here in the chat box. You can revise it also. Okay?
Yes, sir.
Any other questions, guys?
Yes, doctor, please, and the proper counseling. We are explaining the cause that this abnormal link between your body and brain, and we will.
You have already explained this to the patient. In the proper counseling, you need to tell the patient that we are really understanding the problem and there is an impact upon your life. For example, what is mentioned here in the scenario, how about involving your husband for proper partner counseling? How about providing sick notes, etc., etc.?
What is sick notes?
Sick notes, sick leave.
Yes, okay. Sick notes, yes. Okay.
Yes.
Oh, thank you so much.
You're welcome.
Doctor, if you can repeat the definition of the fibromyalgia.
Fibromyalgia definition, okay, it's a long-term problem, okay, that causes pain all over the body. It can cause tiredness, it can cause difficulty in concentration, it can cause muscle stiffness, okay? Some patients might be oversensitive to pain. The cause behind it is unknown. However, we believe that there will be an abnormal link between your body and your brain. So, unknown cause, long-term problem causing these symptoms, abnormal link between your body and the brain, and don't forget to ask about stress. Regarding the concern of the mouth ulcer, as I have told you, patients with fibromyalgia are vulnerable for dry mouth. Having dry mouth per se will put you at risk of development of oral ulcers. And it is very important to mention this as safety netting. This patient, as we saw in the scenario and as told you by the consultant believes that she is having fibromyalgia. All results are normal. As far as she is having this and you have counseled her, this oral ulcer might be something normal related to the disease, which is fibromyalgia. You need to finish your task by giving her some safety netting. If you develop, for example, a skin rash, difficulty in controlling your joint pain, morning stiffness, or sores in your private area, or tummy pain or bloody diarrhea, I need you to come back to seek an immediate medical advice. Okay, guys? Any questions?
How she will fix her job warnings?
Again?
Like in the scenario, he had suffering from job warning. How we will fix that problem?
Providing her with sick notes, for example. Providing her with a letter to the occupational department in her institute.
Sorry again?
Providing her with sick notes. Okay, providing her with a letter to her occupational department. Give her an advice to take days off. Okay?
Thank you.
Dr. Sabrin, is it clear right now? Dr. Sabrin? Okay, guys, I think Dr. Sabrin has left. Okay, if you don't have any questions, as I have told you, I have put here all my links. You can contact me at any time, inshallah, and we will be having our next week, inshallah, session going to be either also communication or long clinical case, inshallah. I'm going to mention it in the WhatsApp group. Thank you very much. See you next week, inshallah. Bye-bye.
Thank you.
You're welcome.
Thank you.